Hi, I'm Owen Morgan.
And I'm Jules Chandler.
This is the Health Hero Chat Show.
And today we're talking all about thyroid.
Okay, so we're back, episode 9 of season 1 of the Spotlight series, and I've always been thinking a thyroid show would be a really, really good one to do, and obviously it would be the most logical choice, Jules.
Thank you.
So thank you for coming on, and we're going to interview some people on their stories and then get into some nitty gritty about all of this stuff and biochemistry and nutrition and
Geek
stuff.
time.
So obviously there's a reason I picked you, so if you just, obviously just let the audience know and myself know just a bit about what you do really.
Well, I am a naturopathic nutritionist. So a nutritionist in that respect means that we start right at cellular level. We get all the way back to somebody's root cause of symptom and disease, and we work upwards to try and manage symptoms. And thyroid for me, I'm just completely passionate about it because I'm a thyroid sufferer myself. I had Graves' disease for the last nearly 10 years. And it resulted in a thyroidectomy about 5 years ago now. Gosh, it goes so quickly. And so many changes happened from diagnosis to thyroidectomy and beyond. I just learned so much. In fact, I couldn't learn enough, so I went back to college and trained to be a naturopathic nutritionist and got all the biochemistry stuff behind it all and worked it all out and fell in love with it. And my passion is I don't want anyone to go through what I've been through. And sometimes people get to me right at the beginning of their thyroid journey and they get better, and that is just, it's not a job. It's a gift, really, and it's just lovely to be able to help people because we don't need to suffer in the way that we do in this country with thyroid disease. It's just unnecessary.
No, definitely not. No, it's amazing. You had a conference recently, didn't you? And it's the idea of that just to raise awareness and
awareness, educate people, to empower them to take their health in their own hands. And you know, we're so conditioned, aren't we, to go to the doctor and take a pill. And when that pill doesn't work, where do you go? What do you do? And so the conference was about educating people and saying this is the information you need to get better or to start making steps towards getting better, because your doctor's not giving you the information that you need to make the decisions that you need to make. And it was a great day. It was a fantastic day. It was really good fun.
Sounds fantastic. Yeah, and it's good that people need to know they have options. They have other options. I guess that's what Heroes is all about. Obviously, is making sure people understand there are other options than the traditional stuff. So it's good that we can complement the great work that they're doing as well on that. But if you want to find out more about Jules' story, we've got the Inspiring Story series, and you came on, didn't you? Tell us all about your story. So if you head over to the Inspiring Story section on YouTube, you'll be able to see Jules' story in full. So I suggest you check it out. It's a really, really awesome story. What you've come through. So we're now going to bring on 2 people to let us know about their experiences, and we'll get into a little bit more on this subject. So let's head over and bring them on. Great, so on the show with us today we have Becca and Gillian. We want to thank you, Becca, for coming on. It's really nice to have members of the public come on and tell their stories. We've had a few people over the series and it means a lot to us for you to come on, so thank you very much. So we're going to find out a little bit more about your stories around this, and I'll hand over to Jules to do this bit. I'm just going to hang out and listen, so I'll let you guys chat.
So thank you so much for coming along. And Becca, I just wanted to talk about your story really. What brought you to complementary medicine? And how did it all begin?
It's a bit hard to know when to start. I felt really rubbish. I'd had a couple of miscarriages and I hadn't lost any weight and still felt miserable. I thought after 6 months I should feel better, and I didn't. I was still putting on weight, still lethargic, still weepy. I thought that was all part of the miscarriage, but I went to the doctor and my thyroid had gone up. I tried kinesiologist, but it was too far away, and then I met Jules. So we sort of rebooted. We looked right down to the bottom, didn't we? We kind of went back to when I had glandular fever, and I attacked my thyroid and my IBS, and looked at the whole big picture of various amounts of stress that I'd been through. I'd kind of forgotten until Jules kindly pointed them out. And then we looked at things, took gluten and dairy out of my diet, and I'm shaking now, but it was really, it was so emotional because I feel so much better than I did 6 months ago. I get quite overwhelmed by it actually, because I can do like work, I can do the ironing, I can do all sorts of things. I'm now doing work for my landscape gardener husband, like out shoveling gravel, and I'm not exhausted. It's amazing. Like, it has made such a difference. So hats off to Jules.
Oh, bless you. And it's so wonderful to see that change in people with such small changes. It doesn't have to be really, really drastic. And I think one of the things that we discuss many times, what's the science behind everything?
Yeah,
because telling someone to take out gluten and dairy, and you're like, why do I need to do that? But actually looking at it and getting to the bones of it, or rather the cells of it, it makes sense. And seeing your timeline and seeing where things are tripped up over your case study, which is full on, isn't it? Because you go from birth all the way to present day with a case study, and to see the amount of stress and things that have happened through your life and where your health has dipped, and to put those two
and
together.
It dipped and not got back up again. I think that was it.
Yeah, and to teach you, about antibody response, and that was great, wasn't it? Can you tell us a bit about your testing?
I got tested for antibodies in my blood, and they were meant to be under 40. They were 1,709, was it? Something crazy. Hence the reason I felt so miserable. And then we took out gluten and dairy, and when we got tested, was it 3 months later, they went down to 179. I thought they'd made a mistake with the decimal point, because it was so cool. So it had changed an awful lot.
And that's just in 3 months.
And that was just taking out the gluten.
Wow.
That's
amazing.
But I didn't know this. And had I carried on, I would have been the same probably in years to come.
Absolutely. And I don't think they tested your antibodies through the NHS because you were within range, or just slightly above range. So they don't do it. So it would have been a point of carrying on, wouldn't it?
And that's what the doctors always say. Oh, you're just within range. You're borderline, but you're fine. We're not bothered. For me, I've also got pernicious anemia, and that's kind of where it got picked up. And the testing, and as you say, they don't see the link.
At the whole picture.
So Julia, did you get that tested through the NHS, or did you have to go private testing?
Well, I did both. Because I'm a little bit suspicious of the doctors now, I tend to double test. So whenever they test, I go and have a private test just to verify that what they're telling me is actually true. And it's funny because I felt rubbish for years and years and years, and I'd suffered horrendous acne as a child, psoriasis. It was only as an adult when I got a copy of my medical notes and I found pernicious anemia had been put on there right back when I was a very small toddler, and I realised actually, talking to my cousins, that there was a link, and they'd all got thyroid problems as well. And it just transpired that one day I found this lump on my neck and thought, what's that? Went to the doctor, went to the consultant, they did a scan and they said, yes, you've got a goiter.
But let's just confirm what a goiter is for people, because a lot of people won't know what we're talking about. Pernicious anemia being a problem with iron and that B12 and everything. And then a goiter is where your thyroid is swollen to the point where it's actually, loss of function, and you can
I was actually beginning to choke, because I originally went to the doctor saying that I thought I'd swallowed something and it got stuck in my throat, and when they did the scan they found out that the goiter had pushed my trachea to the point that it was bent. Hence why I was feeling like I was choking, particularly when I was lying down. But he said, it's fine, we'll just drain it. And so he stuck a needle in, drained, which was horrendous, and went to this absolutely amazing man, Andrew, up in Tame, and he just looked at the scan again, and he said, well, your thyroid probably needs to come out. He took it out a week later, and he said it was probably deader than the dodo. If it had ever worked, he reckoned I probably had it from childhood, and it had just never been picked up, because apparently what I didn't realise is that sometimes even a thyroid that is near enough completely knackered can still fire little sparks that make the blood tests skewed. And it's funny because I've had neck surgery since, and they went through the same scar, but I've got virtually no scar.
Yeah, you can get some very good surgeons. And
I was very lucky. because the surgeon said to me, he said, oh, well, of course, you know, he said, I'd keep the goiter if I were you, he said, because the thyroid scar, he said, it'd look a lot worse. And I remember saying to him, well, actually, you know, doctor, if I was meant to be born with a lump in the side of my neck, then I wouldn't mind keeping it. But, you know, God didn't send me onto the planet with a lump.
No.
And this is telling me my body isn't happy about something. I'd kind of like the lump gone.
How did you feel post-thyroidectomy? Did you have a total thyroidectomy?
Total.
Because it was completely done
completely
in,
knackered.
wasn't it?
So I'm on 200 micrograms of levothyroxine, which I take at night.
And what's the difference? Are you feeling a completely different person
No,
now?
no, because of the B12. I'm better in a lot of respects, like, you know, the psoriasis, the skin improved, things like that. The B12 issue is still there, so I'm still pernicious anemia. I still don't absorb iron properly. There's still that gut problem. But, and although I'm on 200 micrograms of levothyroxine a day, when I wash my hair, it still looks like there's a thyroid problem. I mean, luckily I've got quite a lot of hair, so it's not too much of an issue. Yeah. So I do lose more than I should, but they said that they did put me up to 300 at one point, but then it started to have an impact on my bones, and they said it's the trade-off between keeping it to 200 and being safe from osteoporosis and things like that, or having the more and having a calcium problem. So it's kind of balancing act.
Weighing up the advantages and disadvantages of being on levo.
But I think, you know, if it had been picked up earlier and I'd been sent to someone like yourself and had the proper compound tests, then it might have been a different issue.
Absolutely, and that's, as I said before,
which is quite annoying.
So I meet people now and I'm like, we can stop you from having a thyroidectomy, or we can stop you from being hypothyroid. We can't cure anything, but we can certainly manage symptoms.
So I'm Hashimoto, so they say that mine is autoimmune disorder, one of many.
And we're going to talk about that a lot with Anna.
But it's interesting, my daughter's also Hashimoto, but she's thin and skinny.
Yeah, there is no textbook.
And I'm Hashimoto and I gain weight like a baby elephant.
So individual, aren't they?
It's, you know.
Oh, thank you so much for sharing your stories with us, and we look forward to dissecting all those lovely stories with a bit of biochemistry.
Ooh.
So we're going to come back and see you guys again, and Rita's going to join us on the sofa. I keep saying sofa, I mean chairs. We should have a sofa.
Yes,
but before we get onto that, we're going to head off and hear some top tips from you, Jules.
Oh,
so we're going to head off and hear Jules' top tips, and we'll be back shortly.
Hi, I'm Jules Chandler. I'm a naturopathic nutritionist and I specialise in thyroid disease. So I've got a few tips for you today. If you get your thyroid tested, always get your blood test printed out by your friendly doctor's receptionist. The doctor won't do it, he's far too busy seeing people. So yeah, make friends with your receptionist, get your numbers printed, it's really handy. Get everything tested. If you look at my Facebook page, the Bristol Nutritionist and Thyroid Expert, there's a video on there called Ducks in a Row, and you need to get those ducks in a row. So you need B12, you need folate, you need vitamin D, you need to know what your TSH is doing, and you can pretty much get all those tests done by your doctor. You'll be tired and you'll be feeling rubbish, so just go in, say how you're feeling, and make a list from the video and go and ask for those tests to be done. Third thing, keep your liver happy. Your liver is your primary site for conversion of thyroid hormone, and we talked a bit about thyroid hormone. You release T4 and that converts, and T3, but it converts into T3, and the primary site is your liver. So, did you know that your liver goes through 1.4 litres of fluid a minute? So that's quite a lot of water. So optimally, 2 litres of water a day. Doesn't have to be water, it can be herbal tea or red bush tea or just anything non-caffeinated, or green tea counts as that as well. So make sure you get plenty of fluids. If you really want to ramp it up, have some hot water and lemon in the morning and help your digestion as well. So you're helping your digestion and your liver. Number 4, to help your thyroid. If you are autoimmune, if you have that diagnosis, take gluten out of your diet, even if it's for 3 months, to see if you feel a bit better. Let your gut heal. If you look up some 4R protocol work, you'll see the first thing that most of us do as nutritionists is lift gluten out so that that stomach lining can heal and we stop that antibody response. And remember, antibody response is when your body is attacking itself in an autoimmune concept. If you're not autoimmune, you might want to do a bit more testing, and that's my next tip. Tip number 5 is maybe get some iodine and do some patch testing. Now you'd have to get 15% Lugol's iodine. It's a really good brand, and you would put some on your wrist first thing in the morning after the shower. See how quickly it disappears. If it's disappearing within 8 hours, it might be that you have a bit of an iodine deficiency. Don't just go out and start taking iodine, you need to be taking it with selenium as well. Doing something like that is quite controversial at the moment, because there's research that shows that iodine can make thyroid disease worse. But if you're taking it with selenium and you are deficient from your testing, then it's a safe way to do it. De-stress yourself. Turn your phone off at night, put it on Wi-Fi, put it on airplane mode. Make sure you're getting some time to yourself. I know that's really, really difficult. We spend so much time physically cleaning our teeth, having a shower, washing our hair. How much time does that take? 10 minutes a day, 20 minutes a day? How much do we spend on our mental health? Spending 3 minutes a day meditating could help your mental health and de-stress your body. The thyroid does not work well with stress. It works in tandem with the adrenals, which releases stress hormone, and they need to be calmed down. So do a bit of yoga, meditate while you're washing up, be in the moment, do some colouring with the kids, do some colouring on yourself, go to the cinema on your own. There's loads of things you can do. Just de-stress, get a bit zen. And that's it. Those are my top tips for trying to take care of your thyroid and optimize its thyroid hormone output. For further details, I do a talk in the evening. The next one is on November the 30th in Keynsham, and it's 2 hours of all things thyroid with loads more tips about how you can optimize your output. Thank you.